extremity and right lower extremity. Balance is fair plus. What we have to do is promote normal movement of right upper extremity and promote normal movement of right lower extremity and improve overall balance.
Okay, tell us what you're doing and why you're doing it. First of all, what's stage 4?
The spasticity is starting to decrease.
Spasticity is starting to diminish. Okay. Yeah.
So, no, you can sit on the ball out. Come. So basically what we're gonna have Joanna do, she's gonna sit on the peanut ball.
Okay, talk to her so you get to practice talking to a kid.
So, hey Joanna, how you doing? All right. So, we're gonna sit on here, okay? So try to have your left leg go over. You can hold on to me. I know. Also, her right side is,
the affected side.
The affected side.
Yep.
All right. So what I want you to do.
So it's good that she gets on with her left leg up, right? Or if you want to promote, you can have her put her right leg up, right?
So what we're gonna do, we're gonna move a little bit to the left, a little bit to the right, okay? So left side first, okay?
Okay.
All right. Let's try to balance. Right side. And this is good because, sorry, I'm making my mouth. This is good because when I'm going to the right side, she's gonna have to try to use the right side to balance and stabilize herself. So, all right, let's try that again. Okay. Now let's go back, forward, okay? And then I'm gonna have someone else as a contact on it. Over here. All right, so now try to reach for this on your right side, if you can, using your right hand. There you go. Give that back to me. Now up over here, if you can. There you go. Over here now. So this is going to help with coordination and everything because left side CDA, they have issues with coordination, sequencing, etc.
Okay, so let's start to try to construct sentences, okay, based on this. So you're promoting overall balance, so, right? So patient performed this to achieve that. Go ahead.
So patients achieved performed balancing on a patient performed sitting on a peanut ball in order to achieve balance.
Okay, and then how can we like define, and this is for everybody, right? This is our think tank session, right? So how can we kind of increase that, that sentence? Patient performed what kind of balance activities?
Dynamic sitting.
Dynamic sitting balance on a peanut ball. Right? You see how that works? Okay. Crossing midline activities. Good. Okay. To achieve.
Dynamic balance, sitting balance.
Okay. Good. And coordination of upper extremities, both upper extremities, right? So we really want to start to put it together and be more exact in what we're doing. So just curious, how would you progress this? How would you make it harder? If she had no problem doing this?
Maybe on a Bosu ball, maybe standing, balancing a little bit, and then someone contact guarding.
Okay.
I'm not sure if he said Bosu ball.
Yeah,
Bosu ball.
Okay.
Tossing it back possibly, but that's gonna be over time because again.
Okay, how would you progress this activity? Because what was happening when you were putting her side to side?
She had to try to be upright, try to balance herself.
Okay, but she was what? What was she doing to you? She was kind of reaching for you, right? To hold on.
Right.
Okay, so the way we would progress it, maybe you would do it a little faster. Okay? Or
Without
you could
hands.
do it without hands.
Yeah.
Exactly.
Right.
Okay, you wouldn't even have to progress to the Bosu ball. You can make it a little tougher on this type of ball, right? Okay? You might even throw in something that's not going to be able to reach if she has her eyes closed, but you might try to do some eyes closed type of things too. Weight shifting with eyes closed. Okay? But plenty of stuff you can do at this level with this activity to make to bring it to a higher level.
feet off the ground too, so it
Yep.
doesn't have.
Absolutely.
Oh,
Pick your feet, pick one leg up, shift. You can do like shift to one side, count 1, 2, 3. You know, make her shift and hold herself for 10 seconds. Maybe she can do 5 seconds.
Reaching for the cones, he was over here, so maybe.
oh yeah, yeah, yeah.
lower and
Yeah,
to go.
absolutely, absolutely. So lots of stuff you can do on this peanut ball in this position to make it, you know, kind of bring her to another level, bring her to another level, bring her to another level. Okay, great, you do that? Okay, let's try this. Oh, okay, you don't like this? Okay, let's go back. You know, just constant kind of moderating the activity. Okay, all right, nice job. Okay, next.
Is the home exercise program later?
Yeah, at the end.
Okay.
Should we give this all a group or?
Not now. We're gonna do the 2 other activities, right? You have, promote normal movement of the upper extremity and the lower extremity. You just did the balance activity, right? So what are you gonna do to promote upper extremity and normal extremity, and lower extremity?
What about the? Go ahead. So let's say the patient. Oh. No, thanks.
Right side.
Alright, so.
Okay, somebody instruct.
That was like name for
Nice
this.
and loud.
Okay, Alice, now I want you to move to the green pad, holding my hands. Please move to the blue one. Okay, great. And turn around, and we're gonna back to the black one, okay? Green, black, turn around. Okay, now try to do without my hands, okay? The same activity. Green, blue, and turn around.
Okay, so how is this promoting normal movement of the right lower extremity?
This is reciprocal movement with lower extremities.
Okay.
So we can add more patches and make longer this line also.
Okay.
And increase strength of lower extremities as well.
Okay, what do you guys think?
And
Like it?
also it kind of promotes to keep the stride length.
Mm-hmm.
Yeah.
Yep.
Instead of walking like this, you have to
Yeah,
step
it's sort
further.
of almost like a tandem walking though,
Yeah,
right?
yeah, tandem walking.
It's more tandem
That's right.
walking than reciprocal. How can we do more reciprocal? Yeah, we could use those
Like
blue
this one, how
feet,
many?
right? The blue feet that we have, you could put that.
Mm.
Yep, you could
Good,
do
good.
that, right? Good. Okay. Normal movement of lower extremity, any kind of weight shifting activity you can do, standing on one foot, you know, that really makes those muscles contract and promote stability of the lower extremity, right? Okay, good. What about the upper extremity? Promoting normal movement of the upper extremity.
Well, we don't have it here, but we were thinking of like pulleys,
Okay.
maybe on the ball. So start practicing, strength for the arms.
Okay. What about the peddler?
Oh, this
Yeah, or that one you could use for the upper extremity. Can you grab Ryan the table? Yeah. And bring it over and somebody sit down and be the patient. And we can put the peddler there. Okay, just if you can put it next to the bed. Usually I'll put it the long way.
The other way.
I don't think it fits. No, yeah.
No, the other way. The other way.
That's good. Yeah,
Just move this one, right?
No.
Yeah.
So this one goes the other way.
Yeah,
So there's
and
no
put-
pull towards the patient
right.
like this.
There you go.
Sorry. And then the other way.
And turn it the other way. I mean, at this point, unless you're gonna use the utensil. It's fine, it's fine. No.
No, I mean, that's good. Someone,
Confused.
Oh, that's okay.
Keep going.
Yeah.
Very good.
That's good.
Now you
That's
got
good.
it. Okay, so have her hold on, right? Because she does have some motion. Yeah, that's better. And then with the peddler, you can adjust the intensity. You can make it higher or lower. What do you think we should do at this point? What kind of intensity?
Lower. Lower
Start
and longer.
low, right? Because now we just want to get the motion.
Right.
So it helps to get her into extension, gets her, into reciprocal movement, gets her into fluid, controlled movement. And then if later she's got the motion, then you can work on strengthening, right?
Doing rowing on the,
Rowing is perfect for this one, right? Rowing is really great. Somebody want to row with her?
Roll your board.
Okay, and tell us what you're doing. I'm doing rowing.
Oh, I'm doing rowing. Sometimes in order to promote upper extremity strength and dynamic sitting balance.
Okay, it's more motion at this point than strength, right? Because it's spasticity, she's
Oh,
still
that's
coming
true.
out of spasticity. And how are you doing rowing? Are you doing actively, active assistively?
I'm doing active assistively.
Okay, let's see it.
All right.
Okay, so he's rowing active assistively to promote fluid movement or to diminish upper extremity spasticity.
All right, so let's push back.
Okay, nice and easy, right? Not fast, not fast. And if you want to work more on, what would you want to work on more with this person?
Like
Flexion or
pushing.
extension?
Pushing.
Extension,
Yeah.
right? So tell them,
All right,
keep
push,
going
push, let's
and
go.
relax, keep going, relax. So you don't want them to kind of pull back into flexion because they're already in flexion,
Right.
right? You want them to focus on extension. Try it again, please.
So why do you want them to focus on extension?
Because they're already in flexor spasticity. They're in stage 4. They're coming out, but you don't want to do anything to increase the flexor spasticity.
More.
Okay.
So you don't want them to pull back into it, right? Nice and slow, nice and easy. Talk to her. Come with me.
All right, let's go.
Come with
A bit
me.
more. There we go.
Don't pull back. Come with me.
Come with me.
So natural.
It's like so calm. Exactly. I've done it for years.
Come with me.
Okay, pick somebody from the group to be your patient.
Oh,
No, this
Oh.
group, the outside group, the outsiders.
let's see. Dennis. I want to say Darren, sorry. I was about to say Dennis.
Dennis, okay, where's your program? Okay, so Dennis, I want you to sit and read their home exercise program and read it out loud. That's a lot.
Oh wow.
step by
This
step.
is 2 exercises?
Do you wanna use
Okay,
this chair?
so go ahead and read it out loud and they'll tell you if you're doing it correctly.
Sit to stand exercise. Requirements. Dining table or kitchen countertop. Dining chair or high chair fit for a dining table.
Okay,
Procedures. Sit on chair and place both hands on table.
It's gonna move, so I'll just keep it steady.
This will be a stable chair.
Yeah.
Table.
Slowly
Thank you.
push down at the table. Slowly stand with both feet as much as you can. Hold your standing position for 10 seconds. Slowly bend legs and use hands to support yourself as you sit on the chair.
nice. I like it.
Rest. Important, breathe during activity. Do 3 sets of this exercise.
Excellent, I like it. Okay, good.
All right. Read the next
Okay,
one.
next exercise.
Cruising exercise. Requirements, dining table or kitchen countertop.
So you wanna be at the kitchen counter over here?
Oh,
Here's your kitchen counter.
cruising. Oh,
You know what?
Over here.
There's your kitchen counter.
like a baby. That's nice. That's nice.
Over
I
here.
love kitchen counters. 'Cause I always put the home exercise program, I tape it onto the cabinet, and then I have them do stuff at the counter.
Right,
Sit
right.
on
great.
the left chair. Wait, oh. 2 dining chairs or high chairs fit for dining table. Put a high chair on the left ledge. Put the other chair at around 3 chairs width apart from the left chair. I'm so confused.
Okay, that's why we're doing it, right? That's why we're doing this,
So
cause you
basically-
get to see that.
So sit on the
Yes.
left chair. Which one is the left
So
chair?
there's gonna be one chair over here, and there's gonna be another chair, about 3 chairs with supports over here.
Okay.
Like, not actually to bang them,
Okay.
just for the idea of it.
Okay.
And then,
Sit on the left chair and place both hands on table. Slowly push down at the table. Slowly stand with both feet as much as you can. Put right hand at around a smartphone's width to the right.
that's really specific.
It's useful.
Okay, put right hand, step right foot around the shoebox width to the right.
No, but this is why we're doing it, right? Because until you do it and you see that someone else doesn't get it, you don't, you don't modify.
Okay. So I stand up, this, and then, okay, so I'm walking my hands and my feet over. Like
So
this.
all you have to do is say sidestep, right? Sidestep 3 steps to the right.
Move yourself to the right by
Sidestep
pulling
3
with your
steps
right
to the
hand on the
left.
table and right leg
This stuff
on-
is not easy, that's why we're
Forward.
practicing.
Right, right.
Make your left hand and foot follow towards about your left waist.
Okay, how about sidestep 3 steps to the right? And sidestep 3 steps to the left.
Repeat steps 4 through 7 until you reach the right chair. When you reach the right chair, slowly position in front of it. Slowly bend legs and use hands to support yourself as you sit on that chair. Do not forget to breathe during the exercise to become successful.
Okay,
Nice.
good. So all you would have to say is stand at the kitchen counter, take 3 side steps to the left, take 3 side steps to the right. When fatigued, sit. Done. Right? So this is hard stuff. This is really hard stuff to be able to write something very concisely and to be safe and for it to be effective.
Pictures help.
I'm sorry?
So pictures help.
Pictures
I know,
help,
like
yeah.
at the hospital, there's always pictures on the
Yeah,
handouts.
and a lot of times in home care, they give you like a whole set of exercises to
Especially
give to the
if there's a language
patients.
barrier.
Exactly, pictures help a lot. Okay, good, nice job, guys. Okay, can you read your note, please?
Yes. So for subjective, we have patients complaints of not being able to move good and unable to reach toys. Objective, we have patient negotiated stairs up and down to improve sequencing and coordination. Gentle taps and tactile input to increase flexibility. Pulley for neuromuscular strength and rowing on peanut ball and with contact guarding for balance and proprioceptive training.
Nice.
Excuse me, sorry. Assessments, we have patients show signs of aphasia, instability during pulleys, increase of range of motion in shoulder flexion, and hip abduction. Less focal cues are required during sequencing. So I can't see that. 1 moment. Side frustration halfway through session. And plan can't, continue plan of care to reach stage 5 to further lower spasticity and some isolation. Create home exercise program.
Nice, okay. And then the next time when they come, you're gonna instruct, or maybe your plan is instruct in home exercise program, and then maybe your assessment later is patient is independent home exercise program. How do you know that they're independent? You see an improvement and you ask them. I gave you, remember that homework I gave you last time? Show me how you're doing it. If they're a total disaster or they say, I haven't done it, you put in your assessment, right? But you always check them the next time to make sure they're doing it correctly. Because sometimes you can write things, you can tell them things, and they still get it wrong. Okay?
Don't do it.
Or they don't do it. Exactly. Okay? The only thing I would say is in your objective, this is a really good note actually, but in your objective, try to give me some numbers. Okay, or something.
Like sets.
Yeah, sets, give me something objective, let me know what the balance is, you know, give me some kind of data, right? So that I can measure next time and make sure that when I look back up to those PT goals that I'm achieving those goals. Okay? All right, nice job, group one. Okay, group two, let's go. Read your case, please.
Patient is 72 years old.
No, I'm good. I'm good.
Status post CBA, right CBA 4 weeks ago. Now being seen in outpatient department. Patient with stage 1 in the lower or left upper extremity. Stage 3 in left lower extremity. Balance overall is fair. Uninvolved extremities are fair plus. 1, improve overall strength. 2, facilitate tone in left upper extremity. And 3, normalize movement in left lower extremity.
Okay.
Yeah.
So we're doing the, which one are we doing?
Upper extremity.
Increased tone.
Okay, so they're flaccid in the left upper extremity, correct?
Yes.
Okay.
So hi, Dennis. Today I'm working on your left side to improve some range of motion. So will you please use your right hand to grab your left hand?
Kevin, bring that mirror around if you want.
Oh, wait, do we do this? Because I was just
Let's
asking.
use a mirror and have you sit next to him. Suman, maybe you'll sit up next to him on the left side and you'll use a mirror so he can see what you're doing.
So here's the towel. Wait.
Okay, now we change our plan, okay?
Okay.
Okay, so,
Put it in his left hand.
left hand, oh, wait, he's doing the, frozen, right?
You're the therapist.
Okay, now please use your right hand.
And you can tap, right? If he looks at you funny, just tap.
Okay, use your right hand to hold your left elbow. Okay, put your weight on your left. Okay, you feel your left hand?
Left hand?
Yeah.
Yeah.
Okay. This is the weight shifting. So
Okay, so it's weight bearing
I'm sorry. Yeah.
and
Rooting.
and rude.
Rude.
Rooting
Not
is not a
rooting.
verb. I know everybody says rooting. but it's
Performing rude.
from rude, it's really tactile stimulation, right? To promote
Tone.
Muscle
tone
tone.
in the left upper extremity.
Sensation is,
Approximation is what you're doing.
Try some approximation with him too.
Approximation.
Tell him what you're gonna do. Now what I'm gonna do is,
now I'm going to do is approximation.
yeah, or just say, I'm gonna do a technique to try to get your shoulder to wake up or to have some tone. What I'm gonna, because you don't wanna just do things with people and not tell them what you're doing, right?
Okay. Now I'm going to perform a technique to improve your elbow extension.
No.
What? No.
Help it. Wake your arm up.
To wake your arm up, yeah, that's fine.
It's like this.
Like,
No, that's approximation, right?
Well, you're trying
We're
to
trying
do
to
the
do
root
shoulder.
or
Approximation.
Shoulder.
Approximation.
approximation?
Like this.
Okay, or you can do it at the shoulder too, right?
Like
Yeah,
this.
usually you want to do like shoulder and like the pelvic girdle, right, for the approximation?
Yeah, I mean, you could do it elbow too,
Elbow
you can
too.
try,
The shoulder,
Like this.
because the
It's
the
more proximal.
subluxation.
yeah,
Yeah.
yeah.
Oh, that's right, yeah, because
And
of
you,
something.
what are you gonna tell him? Like, you know, try to tell your arm, wake up, wake up, wake up, right?
Wake up.
Yeah. So that during the day, they can do a lot of tapping, rubbing, tactile stimulation, the more the better. You know, make sure they don't do it too hard. Or if they're on Coumadin, right?
Right.
Which they may be on,
Bruising.
because they're, you know, they may be on Coumadin because of a blood thinner,
Nothing, yeah.
because they've had a stroke, so. But you can just say tap, tap lightly, and talk to your arm. Come on, wake up, wake up, wake up, wake up.
Can I have a-
Or the leg.
Can I ask you a question about the
Sure.
approximation and traction? So in the case of the spastic CVA, mostly it's like this flexion. So that's why we do the approximation to increase the extension, right?
Usually approximation works more with flaccidity.
Plastic. Oh, so
Yeah.
in case of the spasticity, you don't really.
Usually not,
Okay.
usually not.
Then
And
don't
I
you need?
don't usually use traction at all
Uh-huh.
on someone with an upper extremity involvement, because I'm worried about joint stability.
Right, right. Subluxation
So,
possibly. So just approximation
Yeah.
to be safe.
Yep.
And that's increasing the
Tone.
tone of the.
And increasing the Golgi tendon organs to,
Right.
to sort of, you know, work at the joint. Yeah.
Thank you.
And for lower extremity?
For
To normalize movement.
so just
So he's spastic
So
in
what
his
are-
lower
what are
left
techniques?
extremity,
Under
stage
the,
3.
stage
Okay.
three?
associate reaction. You need to start out.
Lie down.
Because I need to resist your right knee extension to improve your left knee flexion. Okay.
Okay, I'd probably have a
Yeah,
little
probably
closer
so.
to the edge.
You gotta be all flexible.
There you go.
Okay, now try to flex your right knee.
Stabilize them above the joint. Always stabilize, right?
Try to what?
Bend your right knee.
Okay, stabilize.
Was it, wait,
Wait.
if you're
Wait,
flexing that,
extend, sorry. Wait.
pretend you're spastic in your left.
Okay, and you're trying to do extension to promote,
To promote the left knee flexion.
Flexion.
okay, so I'm resisting
The right knee extension.
to get,
To get the left
Left knee
knee flexion.
okay, go ahead. Give them some stability at the knee though, with your other hand, there you go, okay.
Oh, good job.
Stop touching.
Okay, try it again. So you're resisting right knee extension,
To improve the left knee flexion.
and he is,
There you
he's
go.
getting it,
Spastic and extension.
he's getting it,
So you wanna try to flex.
yeah.
Good job.
Can we use it with your flaccid patients?
I mean,
We
yeah,
can
you
try,
could try.
in a short
You
sit.
could try.
But
So I just go like
it's spastic on the
You would
lower
be like-
extremity, right?
bringing your
Yeah.
leg
I'm
towards
trying to
you.
extend.
Yeah, you're bringing your leg towards you, so I'm
You can use it for
preventing
like-
that.
Okay. You see, he gets nice flexion on the
There you go,
levels.
there you go. That's better.
Yeah, good,
Sazano.
good. Okay,
So now,
Oh yeah, there was the circle one.
so, yeah, so,
This is-
that's
this
the
is
home
awesome.
exercise.
Oh, that's it. Oh, the HEP. Okay.
Sazano.
I was thinking two steps ahead.
okay, go ahead.
Well, so now we're up to the home exercise program.
Did you do all three?
Improve overall strength.
Okay, what'd you do for that?
You're doing the upper extremity.
Good.
UB.
Hard to do it with a flaccid upper extremity, unless you
Yeah, like-
really like tie him down,
And
Yeah,
which
that's
I've been known
Oh.
to do.
They do it at our clinic, they put ace bandage
Yeah,
in just to get
I've
it
done
moving.
it, I've done it, you just gotta be careful of the shoulder, right?
Right.
I've definitely done it with upper extremity, I ace wrap their hand to the UBE.
Mm-hmm.
You just have to be careful that you don't distract
Yeah,
at the
keep
shoulder
it
joint, you just do
Close
those.
enough.
Yeah, you just do it close.
What were you saying, Ben?
You wouldn't do a new step with a reciprocal one? Could you do that?
If their balance is okay,
Well, like I've seen in the clinic where I work, it's just,
could,
it's just sitting,
yeah, you could,
so.
as long as you're not gonna increase the spasticity of the lower extremity,
Right.
okay? What's a really simple thing you can do
To
to increase strength of the lower extremity?
Sit to stand.
Yes, it is.
Sit to stand is like so simple, it's so easy, and really, really effective. Okay, especially with someone that has, you know, difficulty moving that lower extremity. Okay, what else?
I have a question about the sit to stand.
Sure.
So when we in the group were talking about the home exercise plan of
Uh-huh.
the sit to stand, we really were thinking what would be the balance status that's safe for the patient to perform the sit to stand at home by
Right.
herself or
At
himself.
home, I would probably go with the, you know, it depends. If they have a chair in front of the sink
Mhm.
and, you know, they can pull up, that's okay.
Yeah.
If you're doing it, you know, by their bedside, by themselves, no. I would never do sit to stand. But with you in the clinic, I would definitely do sit to stand.
So if the patient has fair minus, would you
No.
ask no? What about fair?
Fair.
Probably not.
Probably not.
Probably not.
Fair and probably.
I would do it mostly in the clinic.
In the clinic.
I mean, it depends. You know, what's the cognition of the person?
Right.
Is someone home with them? But here it's great because I can just do this, right?
Mm-hmm.
Okay. So, you have flaccid upper, right? Okay, just put your hand here. Okay, what we're gonna do is bring you up to standing. We're gonna do that 10 times really slowly, okay? Ready? Lean forward, nose over your toes, and up. Good. Reach back with the right, and easy does it, no plopping. Okay? And this is a really good exercise.
Nice.
Okay, and I've got it, right?
Yeah.
It's not going anywhere.
since he has the spasticity in his left hip,
Mm-hmm.
do you have to force it in the flexion?
Flesh.
Well, he's in flexion right now. And that's why I'm sort of trying to control everything here, like I'm sitting. I mean, I might even do like this, so I could even control him more, right? So, try it again. Stand up, good,
Yeah, I couldn't move that left foot at all.
right?
Right.
And then reach back and sit,
Oh wow.
okay? And I have a lot of control.
Right. That's good.
Does that make sense? Is that better?
It does. It does. That's better.
Okay.
Can they bend the knee because he has stage 3 spasticity?
He is influenced by spasticity, but doesn't mean that he shouldn't, and I'm really forcing him to do it, right? So I have his foot here to keep him in flexion, so that when he stands up, he's not gonna shoot out into extension.
Our question is how easily are we able to move that knee into flexion? Is it like constantly in extension, or is it like
No.
can we move it?
No, they can sit normally, it's just that usually when they're upright, they're influenced by that extension, right? It's gonna be really hard for them in standing to flex their hip and knee.
Okay.
I know, it's hard to picture.
Yeah.
It's not a contraction, right? It's not a range of motion issue, it's a tone issue. So when they're sitting like this and I'm forcing you, you can flex, right? But when you stand up, you may wanna try, you probably will push in,
Yeah.
but that's why I have your toes over nose, right? Toes over nose. Okay, good. And bend forward, toes over your nose. Good, reach back. And sit. Okay, and I may have the mirror behind me, so he's looking.
Right.
So that's all that, just kind of a little bit of handling, little bit of using your body, right? And using visual.
The mirror is just like proprioceptive awareness.
Yeah,
Okay,
yeah.
gotcha.
Because otherwise, you know what, he may lean to one side.
Right.
Or he may say, I am standing,
Straight.
and he's not standing straight, you know?
Gotcha.
So he can like sort of, if I'm down like this, he can really, and I'm gonna try to reach shift him over. Can you see behind me?
Yep.
Okay, and then reach back. Bend, 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 bend. I love to do cueing, right? Bend, 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 up, 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 go, go, go.
Right.
Makes sense.
Okay, good?
Good. Good.
Okay. All right, where's your home exercise sheet? Who's your patient? Who do you want your patient to be? Pick somebody.
Darren.
Oh, there's this. It's short and sweet. Okay, go ahead and sit down and then, or stand up, whatever they want you to do.
Alright, so clap hands together.
Okay.
I told you.
Claps. I think
Yeah.
claps.
Yeah, it was class, that's her fault.
Clap.
Claps, yeah,
Claps.
claps.
Because clap you can't because he's flaccid.
Right.
Okay.
Alright, draw a big circle in front of mirror. Draw a big circle in front of the mirror with your right hand.
Okay. What do you think they mean?
I'm assuming like this.
Close enough.
But yeah.
No, you
So your,
do
your
what
left
you
arm,
think that they're saying.
Oh, no.
So we can help
Okay.
them.
No,
Oh, I was like this.
Yeah. No, clasp your hands together.
your left, you can't use your left hand, right?
Right.
You're
So if your hands
flaccid.
are together,
Okay. Now it's good.
and then you're just doing big circles with a strong that with the hand that you have strength in.
Yeah, so what, and what are you trying to achieve there?
One is like the proprioceptive awareness,
Mm-hmm.
the
Yep.
crossing midline.
Yep.
Then also just range of motion.
Range of motion, yeah. Good, okay, that's a nice one.
Alright, so lie face down.
17-year-old.
Okay, so you're gonna have him do this in bed before he gets up, right?
Yeah.
Okay,
Face down.
no, let him read it, let him read it.
Or tap or towel or rope on left ankle. Use right hand to pull the ankle towards the back. Use right hand to pull the ankle to the back. So my right hand.
How does
I'm
the
not
ankle
even
get
sure.
how does the ankle
Not
get
even
to the
sure.
back?
This
From
probably
the
this
back.
one from the back
Yeah.
like this.
So
So it's like
Yeah.
like that, right?
Away from it. Things like 70.
Range of motion exercise.
That's what, yeah, he's like 72, so I don't know. Just
Might work,
stretch.
I would probably say bring your foot towards the ceiling. Okay, start it, go back to starting. Lay on your stomach, and bring your foot towards the ceiling. Bend your knee and bring your foot towards the ceiling, that's what you want, right? Bend your knee and bring your foot towards the ceiling. Does that help?
Stretch out the core.
Okay, and you want them to do it fast, slow, because you know people are gonna do it fast.
Slow.
Slow.
Slow
You know that, they're gonna do it fast. Oh my gosh, so many times, you know, you ask people, okay, show me your exercise.
Right. Control.
Slowly, right? And how many times?
It was
3
30
seconds.
seconds for 2 sets.
Hold the stretch.
Hold
Yeah,
it,
so-
hold the
Oh,
stretch
it's
for
a
30.
stretch,
Yeah.
okay, okay. And then you have to make sure that they have something that they can
Right.
bring home with them, right?
Mm.
Either you hook something up or,
They have those like green straps
yeah,
that have the hole in them.
yeah, there's a lot of things out there. Therotubes you could probably use, Therabands might not work as well.
Yeah, we want something that doesn't have much flexibility.
Yeah.
So that they can.
Tubes are usually good.
Mhm.
Okay. Alright, so you're trying to achieve knee flexion, is that the thing?
Yeah, because
And
if it's constant,
stretch
if-
the quads.
the lower leg is, we're thinking in constant extension or extension a lot, then
Okay.
then the hamstrings are really tight.
Okay,
So we wanna We wanna stretch them.
Okay,
Yeah,
now
quad.
what?
Quads are
That activity is against gravity, right?
right.
Can you do something that uses gravity that might be a little simpler?
Hmm.
Come on back here.
Yeah. Legs down.
Have a seat. Have a seat.
This left leg is spastic.
Yeah,
You just put the right leg on top and bring it down.
Could do that. Okay.
it's like that. on the
Lie
edge of the
down.
bed if it's
Lie
hot.
down on the bed. Sit, and then scooch forward. Lie down.
Lay down.
Lie down.
Feet on the floor.
Yeah, feet on the floor. That's it.
Try to get both feet on the floor. You could do that. I would probably put a towel on the floor and have them work the,
Oh.
yeah, because it's like kind of
Right, right.
gravity eliminated, but
Right.
you reduce the friction.
Mhm.
Can you sit again for me? I'll just kick off the left shoe if you don't mind. Nothing but, everything's clean here, but. And then I would just start, you know, bring your leg out and then bring it back. And hold. Bring it out and bring it back and hold. 1, 2, 3. And out. It's gonna be easier for them. Hold. 1, 2, 3. I mean, then hooking up something and then what if they have breathing issues and they were a smoker and, you know, 72 and why did they have a stroke? Maybe they smoked their whole life, maybe they have emphysema, maybe they had an MI. Likely, right, with these patients? So you wanna think about positioning when you do this. Does that work for you?
Mhm.
Yep. Okay. Can you read your note, please?
Sure, yeah, I gotta get a little closer, my eyes are pretty. So the S, patient complains of weakness and loss of sensation in left upper extremity and cannot flex left lower extremity. Objective, stage 3, left lower extremity, and stage 1, left upper extremity. Left upper extremity multi-planar circles with towel, 10 reps for 3 sets. And then, well, now we can't do the quad, but we could do like,
It's okay,
it's still okay, alright.
it's not wrong,
Prone left quad stretch, 30 seconds times
definitely
2.
not wrong.
Sort of struggled a bit with the A part, but we just said the patient displays impulsivity, perseveration while completing HEP.
Okay,
Patient demonstrates difficulty with left upper extremity circles. Exercise needs verbal cueing and demonstrations, and then left lower exercise is independent.
okay,
And then plan, patient requires AFO for left lower extremity, left upper extremity sling, and right pending cane, and then just continue with the
Yeah.
POC.
and then, you know, if, you know, you would put in your objective stuff about the ambulation and the transfers and any stair climbing you might do with them, right? I mean, that
Like
was for this
Minnesota.
case, but,
Verbal cues.
yeah, and then, you know, how many feet did they walk, and what was their balance, and so next time you can talk again about the feet, did they do it, you know, do they have a greater duration, did they need less assistance, you know, all those things, okay? Good, nice, nice job. Okay, group 3. All your measurements.
I know, that's what I said.
Or an objective. Assessment is,
They have to do it when
You
they're.
got there.
no, assessment is commenting on your
Yeah.
objective.
Oh my gosh, it's narrow.
What do you mean?
What improved? What improved? What got better? What changed?
Why is zero attached to the English?
Okay, can you read the case?
Yes,
She threw it.
kind of similar. Okay, so we have a 62-year-old patient, status post-right CVA also, 2 weeks ago. Patient is in short-term rehab, left upper extremity in stage 2, left lower extremity stage 4.
Okay.
Sitting balance is fair, uninvolved extremity is good, standing balance is fair minus.
Okay.
So our goals are to improve sitting balance, improve standing balance, and facilitate functional movement of the left upper extremity,
Okay,
which is in stage 2, just to remind you guys.
great.
So this one, so standing balance is fair minus, so they would not be able to stand on their own.
Right.
So we're assuming they have an assistive device, or
Okay.
we're giving them one.
Okay. Yep.
Do we we should have gotten that.
You can take the wheelchair out if you wanna use the parallel bars.
Yeah, we do. We can do it without the parallel bars, but we wouldn't do
Yeah.
it in parallel bars.
That's fine.
2 weeks after, use the parallel bars. Safe.
Well, in life we would, yeah, but just for demonstration.
This is, what do you mean?
Real life.
This is real.
Okay, well, now we're using the parallel bars.
You gonna use the standby or the handy? Handy? You wanna try the handy or standby? 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 But then the patient has.
One-arm drive?
Hemi walker might be okay. Hemi walker's probably okay. This guy.
Okay, so I'll start over one balance.
Just flash scratches then.
Oh, we're doing the final one?
Yeah, just start with the okay, who wants to be patient?
I'll be the patient, sir. So
Okay.
it's the right CVA, right?
Okay, yes, right CVA. Yeah, so, okay.
Left is
So-
just starting to develop some tone.
So like this.
Starting to be influenced by tone.
So, yeah, so we're just gonna basically have our patient here, just work on standing balance, so hi Jen, and it doesn't really look like much from that. Okay, so go ahead and take hold of your walker here. This side, okay, and, come forward, plant your foot on the ground. Okay.
Very
Do as I say, wait for me. Okay, so lean forward, and on the count of 3, we're gonna stand up, okay? 1, 2, 3, easy now, good, okay. Okay, so we're just gonna stand for 30 seconds and hold it, and, in reality, it probably wouldn't be going this well.
And again, mirror's good, right?
Yeah.
Head up, look in the mirror,
Mhm.
come towards me a little bit. You can see he's pushing away from you a little
Mhm.
bit.
Yeah.
Come towards me, shift your weight.
Wait toward me.
Much better, much better.
Good. And as things progress, you could try to have the patient put, release the thumb on the walker, maybe have the back of their hand, maybe one finger. Different things you can do to keep stepping the balance up. We can even have them close their eyes. Yeah, so we just hold that for 30 seconds, then have a seat and try again. Yeah,
Okay.
just
Reach back, reach back.
take your hand off your walker. Or
Reach
not
up.
yet, maybe.
Watch your gait.
Okay, come down, reach for the mat.
Push from what you're sitting
Reach, reach,
on, reach back.
Sorry, this is not good. Okay, good job. Yeah.
That's a very typical patient, by the way.
Yeah, thanks. Okay.
That was standing balance, right?
Yeah.
Okay. That's sitting balance?
Good, let's do the clinic first. Rowing, do you wanna row?
Row.
I
Oh,
think
row.
Okay.
Somebody be a patient for me?
Oh, I'll be patient.
Okay. Hello, Josh. Hello, I'm Jin. We're gonna work together, okay? I know you have some specific exercise. We'll work together to do better, okay? So hold my hand.
Okay, so you're doing rowing.
I'm trying to do the, I'm doing the rowing to improve the.
Okay, how are you doing rowing?
Oh, yeah, why is it?
In a slow
Okay.
and calm pace, but with some resistance in pushing. It's like active assisted. Active assisted, yeah.
Okay.
Yeah.
Or you could do resistive to promote extension, right? You could do
Yeah.
associated reaction in extension if you wanted to do that, but I would probably at this point just do active assistive.
Okay.
Try to get them, more fluid instead of, sort of continually influenced by that.
So we're gonna roll together. Okay. Slowly you push, good, and then pull. Good. Push, good, and then pull slowly.
Okay, so if Brunstrom, if Jin was Brunstrom, okay, what would he do?
Resistance on the
Resistance on
yeah,
my right.
Resistance on
Overflow on
the
the
right
left.
side with pushing, so the left side can push it.
Now, if Brunstrom would wanna do, if he was in stage 3, what would Brunstrom wanna promote?
Stage 4. Yeah.
3, right? She would wanna
2
promote
to 3.
increased flexion, but we don't wanna do that,
No, no.
right? We wanna promote normal, so we're gonna work on more extension,
Extension.
right? We don't want him to go more into flexion,
Right.
that's not normal movement, that's not functional movement. So we're gonna get him really to do more fluidity and try to get into extension.
No. Alright, now I'm gonna resist you a little bit, okay? Let's go.
Resisting into,
Let's go. I'm gonna push.
resist into
push.
extension.
On the right side.
Let me
okay?
take you, relax,
good.
relax,
Now,
don't
okay.
let him pull into flexion,
Push.
Good.
Okay, good.
relax,
Now again, push.
nice,
Good.
nice.
Relax. Push. All the way. Good job. One more time. Look at me. Take a deep breath. Good. Breathe. As you push, you breathe out, okay? Push, breathe out. Breathe in, push, breathe out.
Good, nice.
When you
Okay,
say spasticity begins, I mean, is it drawn up and it just started, or do you mean like it started?
it's starting to come up, so what's gonna happen is you're gonna go and reach out your hand to shake their hand, like they may have their hand like this, and then they're gonna come into this retraction, flexion to do anything. They're not just gonna go, hi, how are you, right? Everything is gonna be done in kind of that pattern. You know, if you put a glass of water in front of them, they're not gonna do this, they're gonna do this. So they can't quite break out of the spasticity, but it's not full spasticity. When you see them, their hands are probably resting on their lap.
Okay.
This is
And
early
so-
on, though.
It's early.
Yeah.
Yeah.
So then when you say like a stage 4 or 5, they might still be spastic, but it's able to relax more?
Yes,
But
and
it would
able
still
to
be-
sort of, you know, maybe raise their, they may, like if you put something on a shelf, they may still be influenced like this, but at least they can get their hand up into flexion
Okay.
and reach a little bit. But they may still be retracted, they may still be flexed at the
And a resting
wrist.
position may still be here.
It may be,
Okay.
yeah. But when you ask them, you know, put your arm down, they can,
Okay.
they can start at
So it's
least.
like, it might be up here without their realizing it.
Right, but then you say, put your hand down and grasp the side of the bed, they can do that, but in a 3, they won't be able to. Yeah, it's interesting, when you see it, it makes more
Yeah.
sense,
That's,
right, where's Joey? Does it make more sense now? Cause you're seeing a lot of patients with spasticity, right? And flaccidity.
Yeah. Some, mostly spasticity in the lower.
Lower extremities.
You could try it.
Yeah, maybe.
Yeah.
Speaking of Lundstrom, maybe this is the inches. Who wants to?
Maybe the patient. Yeah, good.
Okay, so, next, so go ahead and lay down on the back.
Right to it.
Okay. This is okay, actually, I mean, well, we just have them lying down like a normal person. I guess if you wanna stretch your quads, it doesn't really matter, but just lie on the, yeah. Okay, so Darren, I'm gonna have you reach over with your right arm and grab hold of your left. Good? Okay, so now, as best you can using both, just go ahead and bring your arm up in front of you. Good. Now you're going to pull with this hand and try to push with your muscles back here so that you're, like, try to touch my hand. Good.
Trying to get them out of that retraction, right?
Exactly. So this is assisted protraction, using the uninvolved side.
Nice.
And that's, something that patient can also do at home very easily.
Great.
So, good job.
Ready for your, yeah.
So, remember when you were talking about the cock-up brace, you just wait the patient over 90 and you show flexion and then
Yeah.
it's gonna come up. Is it only the hand or it's also the elbow that gets affected in a way?
So, thank you. Sometimes you'll see both. You know, it's really different with most people because they probably are not gonna come into a nice extension.
Yeah.
But if you can kind of get them, relax, do a lot of rotation, and then get them up, hopefully you're gonna also promote that extension. Probably not a perfect extension though.
That's easy.
Did you try soaps?
Yeah,
Doesn't always work.
Okay,
HEP time.
Okay, who's your patient?
And let's use Michael.
Because I made fun of your drawing.
Okay, we can't explain
I,
it.
okay.
We can't explain it.
Read it out loud and tell us what you're doing.
All right. Trunk lateral flexion in supine to right side.
So right away you should say
Well,
What's
side
supine?
bending, right? Okay,
yeah,
okay.
it's the official name.
I looked it up on Google and it says lay on your back.
I
Lay on your back, knees bent.
explained it.
Thank you for keeping our mats clean. From New York City dirt and grime.
Okay, lie on your back, knees bent. You can do this in bed. Engage your abdominal muscles on your right side. Allow your trunk and right pelvis to pinch together. Hold for 5 seconds, release and repeat.
Yeah.
5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Right?
Yeah.
Okay.
Yeah. just
Okay,
engaging
so I
in-
give you one more key, you could do this. With their hand, they could reach for their foot.
Oh, yeah, yeah, that's good.
And you could actually do it on both sides, right? Or you just preferred one side?
Could they do it on their affected side?
Try.
Okay.
I'd say they
guess we
could, but-
yeah.
So
Try,
Yeah.
give
we
it a
came
shot.
up with this idea to do it to the uninvolved side because the patient tends to
Lean towards the,
lean towards the
yeah.
involved side.
So we have lean towards the
wanted to
uninvolved.
establish the midline.
Yeah.
Oh, there's 3
But
exercises.
I think it's beneficial to do it both ways.
Mm-hmm. I mean, it's more important.
Standing in front of the mirror. It worked. He's healed. Using the mirror in your home, hold onto your wall. Oh, walker, sorry. And look at your reflection.
Nice.
Notice if you are not standing up straight and try to right yourself. Focus on your midline. Do this once a day.
Yeah, it's good. Just posture re-education.
Yes.
Postural re-education.
And there's one more. Penguin. Sit on your bed with your arms at your sides. Holding your trunk up like a kickstand. Gently shift your weight back and forth between hands. Oh, that's perfect instructions.
Thank you.
Still think the drawing's funny.
All right.
Nice and slow, right?
Yes.
So we
Sorry
came
about
up
that.
with this idea, but we were just talking that if the patient has stage 2 spasticity, would it be possible to put the hand down on the mat?
Yeah, because they're just
Oh.
inflection, right?
Yeah.
I mean, you know, they're probably here.
Mm.
They might have to place their arm down,
Oh, like that.
but weight bearing would be good.
Okay.
You know, weight
So
bearing
it
would
is
be
possible.
really excellent, yeah.
We're just
Yeah,
doubting
because they're not in
ourselves.
full synergy yet.
So if it's stage 3, then it would be probably impossible.
Probably be difficult, yeah.
But
It would be
it's
difficult.
stage 2, so it is possible.
Yeah, I mean, I would really probably use it a lot,
Okay.
you know.
I have a question actually, because we were also thinking about using something with cups. But there's a CBA patient at my clinic, and they had her basically just stacking the cups with her
Okay.
involved arm. But if
Okay.
she's spastic and she's sitting like this, would she be able to kind of like reach over and stack that, or would she have to be using more of the uninvolved side?
I might do an assisted reach,
Uh,
you know, to try to get her to do it. She may not be able to, and like just what you did, fall over.
Yeah.
Because she's trying to use her whole body, but I might use like an assisted and give it a shot. Yeah, anything you can get, anything you could do to get them out, right?
Mm-hmm.
What were you gonna say?
When we're talking about the weight shifting with the hands spread out, if they're kind of spastic, was there any benefit to having like blocks that they could push into if they can't be in full extension?
The
maybe
push-ups?
even slight
Oh,
extension?
blocks.
Yeah, the push-up
Oh,
blocks
yeah.
that you
Oh,
see,
that's a good
anybody
idea.
see those, the push-up blocks in the clinic?
No.
They're like wooden and they have, you know, handles on them, push-up blocks.
That could be
Or I might just even do it in
Or like yoga.
semi-reclining,
Yeah.
right? And just do
Oh, yeah.
some weight shifting and
right.
semi-reclining.
Yeah.
You're still at least getting shoulder, or even in front, you know, on a table,
Yeah.
weight shifting. Even if they can't get on extended arms, I would just try to, you know, promote like shoulder.
That's good.
Thanks.
Yeah, in your core, when you're doing
Yeah.
the recline,
Yeah.
a lot of pores.
Exactly.
Good, good.
Read your note, please.
Patient complains of loss of balance to the left, especially in ADLs, difficulty with walking, easily fatigued, difficulty in most of ADLs regarding moving objects. Home exercise programs include trunk lateral flexion and supine to the right, standing in front of a mirror as tolerated, and penguins and sitting. And therapeutic activity is, what did I say? Oh, standing, moving,
Cups.
oh, cups, oh, right, with the left upper extremity. Therapeutic activity, standing within parallel bars, 3 sets of 30 seconds. Neuromuscular is rowing, and then we threw in Easton, like NMES, as a possibility.
Yeah.
And then assessment, patient requires verbal, visual, tactile cueing during therapeutic activity.
Nice.
Was able to perform post-intervention. What does that say?
Yeah.
Post-instruction, patient was able to demo back all of HEPs. Plan to continue with the current plan of care to increase strength, balance, range of motion, and decrease spasticity.
Nice, I love that sentence. Good, good. Again, a little more data somewhere,
Yeah.
so that you can reflect on it in your assessment, so that you can see that they're getting better, so that you can see that they're achieving those goals, that you're measuring something, now able to, that kind of stuff in your assessment. Okay? Okay, I definitely don't want to rush through the last question. So if whoever's in that group could take a picture of their note, because I doubt that this is going to be here on Tuesday. Take a picture of your note, and we'll, when we resume on Tuesday before we get into spinal cord, we'll finish this last question. Okay? Because I think it's important. I don't want to rush. Do you see what we're kind of doing here? Right? And this is what we'll be doing like through the whole semester with every module.
Will we, for the practical, will we be able to write notes? I feel like it's just so much to like unpack and then also remember what you want to do for your interventions.
For the final,
Yeah,
yes.
not for this one.
I mean, for this one, it's basically, 3 simple, activities, right?
Okay. Still, I just feel like I couldn't have done this without really taking time unpacking it and writing things down. It's just a lot. There are a lot of variables.
Yeah.
Strength grades and balance grades.
Yeah, and keep it simple. That's my advice too. Keep it really simple. But, you get a minute or two to organize in your head before you perform, but I think you can do it. But definitely on the practical, on the final practical, you have 10 minutes to write down whatever you want.
Yeah.
Whatever works for you.
Okay.
Okay? Okay. All right, thanks, guys.